The final common cause we're going to discuss today is the SI joint or sacroiliac problem. Someone with an SI joint or sacroiliac problem typically will have more pain with sitting, getting in and out of bed, rolling in bed, getting in and out of a car. They would also describe their symptoms as the leg kind of feeling like heavy, feeling weak on the side that they're having trouble on. And in severe cases, they may even have difficulty controlling their bladder. And the distribution of the symptoms, now in a typical herniated disc or DDD arthritis or spinal stenosis, the pain would go from the back down to the buttock, down to the back of the thigh, down the leg. Someone with a sacroiliac joint or sacroiliac problem, their pain would tend to wrap around the butt into the side of the thigh, down the side of the thigh, and may radiate all the way into the groin. Now, where is your sacroiliac joint? You can see in this image here, this is the pelvis on the right side, and this is our sacrum, which is essentially the top of our tailbone. So the sacrum and this top portion of our pelvis joined together. The top portion of the pelvis is called ilium, I-L-I-U-M. So the ilium and the sacrum joined together to form the sacroiliac joint. So let me flip this around, and it's much more prominent from the front view here. You're looking at the front of our pelvis. So this is the sacrum, this is the ilium. They join together right here in this joint called the sacroiliac joint. By the way, the sacroiliac joint issue or sacroiliac problem is the sneakiest cause of lower back pain because it does not easily show up on an x-ray or an MRI. Again, how do you know if someone is suffering from a sacroiliac joint issue? Again, they'll have trouble with sitting. They get relief from standing or walking around. They'll also report increased pain with rolling in bed or turning in bed, getting in and out of bed, getting in and out of the car. And again, the distribution of their pain, instead of it straight down the butt and down the back of the thigh, it would tend to wrap around the buttock, down the side of the thigh, down the side, and in severe cases may even go into your groin. Also, when you ask someone with a sacroiliac joint issue and you ask them, where is your pain? They would point almost always to the dimple in our butt, just right above the buttock. There's a dimple there on each side, and they will point to that dimple. And when they do that, that almost always denotes that the sacroiliac joint is involved. Now, what age group does a sacroiliac joint issue affect? I have seen people from early teens all the way to their 90s presenting with a sacroiliac issue. Most common cause of this is usually a fall on the butt, or you miss a step, or you miss a curb, or you step into a small pothole, your leg gets jammed into the pothole, or even in cases where you get rear-ended and your foot is on the brake and your foot gets jammed into the brake, that force gets transmitted to the sacroiliac joint and could cause issues with this. So if you've been getting treatment for your lower back and you're not getting the relief you're looking for, and you're not getting the results you're looking for, in most cases the sacroiliac has been missed, has been ignored, and probably and is most likely the cause of your problem.